Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries, injury treatments, and injury prevention so that you can stay healthy and perform your best. Now, so much of what athletes and active people experience in terms of sports medicine, and injuries and pain aren't necessarily the traumatic injuries where you're running down the field and somebody tackles you and you blow out your knee, or you do something where you throw a pitch maybe in baseball and you feel a pop in your shoulder and you suffer a traumatic event. So much of it is just pain. It's not necessarily a structural injury, but it's just this nagging discomfort. It may be pain in your Achilles tendon. It may be pain on the outside of your knee that could be IT band problems. There's so many aches and pains that people deal with that really can keep you from doing the sport or exercise that you want to do as well as you want to do it. Now, if you're fairly confident that you don't have structural damage and think, hey, maybe this is just inflammation of whatever the body part, your knee, your shoulder, your ankle, whatever, what are some steps that you can take to try to decrease inflammation, basically try to get it better, short of going to the doctor, getting x-rays and MRIs. So are there steps you can take to try to get inflammation better? So let me suggest a few for you right off the bat. The first thing I might say is take a few days off. If there's some nagging pain, a lot of times it's from just doing the same exercise, same activity over and over again. So take a few days off. You don't have to quit exercising completely, but maybe you stop running for 2 or 3 days and you do something that stresses other parts of the body. Maybe you swim and work your shoulder, or maybe you ride a stationary bike so there's not the repetitive impact, but you still get a good workout. So that may be the first thing you try. Something else you could try would be to ice that body part. Now, there has been recently some question about ice after acute injuries. Is it actually all that helpful? But it can definitely help decrease inflammation and certainly make whatever that injured body part better. So, if it's your knee, maybe you put a bag of ice on your knee for 20 minutes after you run, or after you play soccer, whatever causes that pain. Or if it's your ankle, or if it's your shoulder, a bag of ice a lot of times can make you feel really good. Another thing you might consider trying at least are anti-inflammatory medications like Advil or Aleve. There's so many over the counter. There's some prescription ones too. Now, like ice, we're starting to question the role of anti-inflammatory medications early after injuries. There's some concern growing that maybe some of those medicines actually slow healing. But if it's really an inflammation, some tendon or ligament or muscle or joint that's just inflamed, those medicines may actually get it under control. They have side effects, so if you have a lot of medical problems, it's worth checking with the doctor, and they're probably not meant to be used for long periods of time, but it is an option as well. Another terrific option that you might consider would be to work with a physical therapist. A lot of states, South Carolina is one where I am, you basically have direct access to physical therapists, which means you don't need a prescription to see a physical therapist right off the bat. You need to check with your state, because in some states you actually do need a referral from a doctor or other healthcare provider to see a physical therapist. But at least here in South Carolina, you can call a physical therapist directly and go to them for up to 30 days before they have to get a referral or prescription basically from the doctor. But physical therapists, there's so many things that they can do to get that aching shoulder, aching knee, whatever the body part better. Yeah, they've got exercises to strengthen that body part and the surrounding muscles. They can correct your technique to take stress off that area. They can work on stretching exercises. They've got modalities, things like ultrasound and dry needling, and so many different ways that potentially could make you better. So it's certainly something worth considering. See if you can potentially see a physical therapist. And then last, it would be to consider going to the doctor. If you try some of these steps and it's still bothering you, you can't do what you want to do, get it checked out. I know so many people worry that an orthopedic surgeon is going to basically try to talk you into surgery or basically shut you down for a long period of time for whatever sport or exercise it is that you like to do. But a lot of times you'll find out that, hey, this isn't structural damage, and we can suggest some simple things to get you better. And knowing that there's no ligament tear or broken bone or whatever it is, you know potentially you're not doing any harm to it. So other than the cost and maybe a little bit of time, I do think there's a good role, to see an orthopedic surgeon, a sports medicine doctor, and find out what your injury is. Now, have you battled some nagging pain, aching joint, whatever it is, playing a sport or doing your exercise, and how did you get over it? Do you have any other tips for decreasing inflammation? I'd love to hear your thoughts. So below this video, I would really appreciate it if you'd share your thoughts and your experiences. Maybe it can help other people who are dealing with inflammation in sports and exercise as well. Now, if you know somebody going through some nagging pain, I'd really love it if you'd share this video with him or her, and hopefully it can help your friend or your family member overcome that nagging pain and get back to exercise as well. Now, if you like more videos like this and you want more information on injuries and injury treatments and injury prevention in sports and exercise, subscribe to my video channel. I record a couple of these videos every single week, and they get delivered directly to you. And last, go to my website, drdavidgeyer.com. I record and write and share so many resources that I create, completely free resources on ways to stay healthy and perform your best, whatever your sport or exercise, and I only share those by email. So go to my website, sign up, enter your name and your email address, and I will deliver those to you on a fairly regular basis. Thank you so much for watching. I really enjoyed it, and I hope you did as well. I hope it was helpful, and I look forward to seeing you right here next time.